Hi, this is Dr. Mark Levandovsky. I'm the founder and medical director of Preventive Medicine and Cancer Care here in Denver, Colorado. And today I'd like to talk to you about biodiversity and gut biodiversity and how it relates to our health and well-being. There's been a growing body of literature that has been showing that the gut biodiversity is inversely proportional to our cardiovascular and cancer and autoimmune health risks, such that about 75% of our immune system resides within our gut. And we know that the healthier and the more diverse the gut is, the lower the risks of cardiovascular complications, of heart attacks and strokes, of autoimmune conditions and cancers. So much so that a number of folks who actually have gastrointestinal or autoimmune cancers, autoimmune-related cancers, like melanoma and kidney cancer. There are novel therapies that are looking to bridge fecal transplants, so introducing healthier gut bacteria into the gut with chemotherapy-type approaches. And the responses have been very, very impressive. So rather than looking forward to a fecal transplant, it would behoove us to improve our gut biodiversity through lifestyle and pre and probiotics and improving what we eat rather than ingesting external fecal contents, which could be done scientifically, but not highly recommended at this point. So we know that folks who consume Mediterranean plant-based whole food diet have some of the richest microbiome options and contents amongst those studied. And that improves their content of lactobacilli, which are very helpful, bifidobacter, of Akkermansia, of ruminococcus. Those specific bacteria appear to break down more dangerous or inflammatory associated proteins and components that cause cardiac irritation and inability to forget to process chemicals in a healthy fashion that appears to be predisposing cancerogens and inflammatory changes within the heart. What we do in the practice is actually check one's microbiome content, seeing everything that they house, what the content is composed of, what are the pathogenic bad bacteria that one has, and what are the good commensal helpful bacteria that one has, and how to improve the gut real estate, so to speak, so that we can improve and increase the numbers of healthy bacteria and decrease the unhealthy, dangerous or pathogenic bacteria. We do that through a combination of lifestyle and pre and probiotics and certain supplements. As a result, we're striving to get our patients into top notches, basically 2/3 plus improvement into their gut microbacteria content, so that the immune system is working better. They have a lower risk of cardiovascular disease and cancer, and incidentally, improving their gut and brain connection, since the majority of serotonin, dopamine outside of the brain is produced in the gut. Hence, many conditions such as inflammatory bowel disease, irritable bowel disease, and anxiety and depression have direct echoes and direct symptoms that very much affect the gut. And often, if we improve the gut function, we can affect the way the brain perceives. We can improve serotonin levels, and we can take folks who are feeling, quite poopy and miserable, no pun intended, to folks who are actually doing way better and less anxious. So not only to conclude, does the gut help us with improving our digestion and digestive efficiency and digestive health, but very much related to cutting the risks of cardiovascular and cancer by as much as 50+%, has been shown in some populations, as well as makes us feel better, literally better, by having higher levels of serotonin and dopamine and improving our emotional health as well. If you have more specific questions to how we approach gut health in the practice, by all means, feel free to reach out to us. We'd be happy to help. Be well.